A very good evening to you. I'm Lisa Lorde, and joining me is Prime Minister the Honorable Mia Amor Mottley, and she's joined by the Czar for the COVID-19 for Barbados, Richard Carter, to answer some of the pressing questions Barbadians have regarding the coronavirus. Good evening to you both.
Good evening, Lisa. Thank you for coming here today and let's talk.
You're welcome. Now, these questions have been drawn from social media and some of the calls we would have received in our newsroom over the past couple of days. One of the biggest questions we would have received would be regarding the fact that we have not instituted a ban on all travel. Just today, Trinidad would have instituted a 14-day ban on travel. They've closed their borders. Why has Barbados not instituted a ban as yet?
Let me say I haven't seen or heard anything on Trinidad because I've just literally come to this session, and I wouldn't want to comment on Trinidad, especially as chairman of CARICOM, without speaking to my colleague Keith Rowley. So let me just answer without reference to Trinidad at all. Barbados has been planning this now for almost 2 months fully. And the Ministry of Health, along with the entire government in a whole government approach, has been very careful about how we plan and what is triggered at each stage. Thank God, thus far, we haven't had a case, but we anticipate, as the doctors have said to us, it's not a case of if, but when. We also recognize from the science that the science is very, very clear with respect to the fact that the majority of people who in fact may get this virus are in fact going to only get it mildly, 8 out of every 10 people. There are 2 distinct vulnerable groups, and our duty has been thus far to ensure that we can minimize the exposure of those 2 vulnerable groups, to make sure that we build capacity in the event that we are ready when it gets here, because we were told it is not a case of if but when. But we also have to be conscious that as a small island of 166 square miles, almost everything that we use, everything that we do has an international component. And therefore, the question for us has always been, will more people be affected negatively in a major way from closing the borders than from screening properly ahead of time, making sure that we do the temperature checks for people coming into Barbados, making sure that we are now adding to that declarations. We've been in conversation with the various airlines to more pre-screening. But we're also conscious that in any event that there are decisions that people will make on their own. We believe we have to follow the science. We recognize, however, that the news cycle has also triggered people to take more decisions that may not necessarily be rooted in the science, and therefore, to some extent, what we are also facing is decisions that are taken by countries that can feed themselves, countries that have the capacity to do whatever they need to do to sustain equipment and a whole host of other things that people may need for day-to-day living. And ultimately, if we get to that stage, we will get there not by reason of the government making a decision alone, but because we have gone and we've consulted all of the stakeholders. Over the course of the last 10 days, we have been almost in daily consultation with stakeholders. This will continue. And with respect to the earlier behavior, for the first 6 weeks, it wasn't really an issue because we didn't ban people, but we said that if you were coming from China, if you were coming from Italy, if you were coming from South Korea, if you were coming from Iran, that you would, if you did in fact come to Barbados, you would have to be quarantined. Because the flights from the UK have so many more people, and because Barbados is so much more dependent on the UK, the taxi drivers, the hotel workers, the people working in laundries, the people working in restaurants, think of how many tens of thousands of people in this country are going to be affected once the borders close. Now, we accept that we're dealing with a disease, outbreak, that will affect probably 3 to 8 out of every 1,000 in a fatal way. But we may, in fact, affect far, far more if we immediately close our borders, ensuring that people who depend on a weekly wage or for whom this is the only source of income may not be able to feed themselves, may not be able to buy what they need day to day to sustain their families. And one of the reasons I have taken the decision to have Mr. Carter appointed is that he went through all of this with Ebola. And Mr. Hart, who is not with us today, but he also was there. Barbados is lucky that we have two people who were at the center of the Ebola outbreak. And as far as outbreaks go, the Ebola was far more deadly than this one. So this is a fluid issue, but at this stage in time, we believe that we've taken the right decisions to increase our pre-screening, to be able to have information so that we can do the contact tracing, and to ensure that we can keep as many people functioning without necessarily affecting the vulnerable groups. Against this background, I want to use this opportunity to say today that we would like, and the Ministry of Health is going to reach out as well through its social messaging, as well as Mr. Carter, that persons who are over the age of 70, they are most vulnerable. And we would like if they would start to take decisions not to go out as often as they should, to be able to self-quarantine for the most part for the next 12 weeks or so. Part of the difficulty with closing the borders, or even with doing all of these other things, is that the Ministry of Health, PAHO, CARFA, WHO have been consistent in telling us they don't know when this will end. Now, you can't close down things without knowing when you're going to be able to open them back up easily, particularly since they've said that this will come in 2 or 3 distinct waves. So that, in a very real sense, people are going to have to manage themselves at an individual level. I'm appealing to all Barbadians that we each have to, one, take care of ourselves by taking all the measures, from washing your hands, to not touching your face, to all of the other things that the Ministry of Health is guiding you to do, to distancing as far as possible. But at the same time, to recognize that we need to take care of those who are more vulnerable, our grandparents, our aunts, our mothers, our fathers, whoever they are, and to be able to help them minimize their going out. And is it a sacrifice? Yes, it is. But they can read, they can watch television, they can do some gardening, they can do so many different things. But what we want to do is protect them at all costs. We can't shut down from the world fully. We can't do it in terms of goods, and we can't do it in terms of people movement infinitely. So that is the difficulty that we face. But we will have this conversation. I expect the Minister of Tourism is going to be meeting with the BHTA this afternoon, their executive, and the wider group tomorrow. The Minister of Education has already had initial meetings with the unions, but she's going to have a wider group of meetings, I hope, either tomorrow or Wednesday, but I think tomorrow. And we expect that we would like to be able to meet with as many stakeholders who depend on the borders being open by Wednesday evening. And if the country says that this is a way that we're prepared to take, in spite of the fact that it will bring untold hardship to large numbers of people, and we're talking thousands of people, rather than us recognizing, as has been recognized elsewhere, that it is critical to build up hospital capacity. And by hospital capacity, we don't mean the Queen Elizabeth Hospital, because we have taken a decision to isolate the Queen Elizabeth Hospital for the treatment of persons with COVID-19 as far as possible. Clearly, we can't stop people from coming there, but we've said to people, please don't come to the QEH. Use the hotline. We've expanded the numbers of people manning the hotline. I believe they were trying to get a WhatsApp number as well, so that people can write and text. And we have been calling them back and sending people. Every day we've been doing tests. Yesterday we did some. Today we're doing another 10. Almost every day we're doing tests, because it is the sensible and reasonable thing to do. We get more test kits this evening, and we will get some more, we believe, tomorrow.
All right, on the topic of testing, now across social media, both Barbadians and non-Barbadians are questioning the integrity of the island's reporting on the virus and our testing. Now, many believe that given the volume of traffic we get from countries that have cases, that Barbados should have recorded a case by now, and that we're covering up for the sake of our economy. How do you respond to that?
I've been in public life for 30 years. I've made it a virtue to make 2 eyes make 4 and to speak to people directly. I am telling you that nobody in Barbados has to doubt when there's a case. Because I tell my ministers, I tell everyone around me that the only way I know how to lead, or the only way I know how to represent people, is by speaking the truth. And very often there are those who will tell me that your political career has been checkered because you have perhaps spoken the truth too often, and that sometimes the truth is a hard thing for a population to bear. I take comfort at this moment in time that Winston Churchill talked England through a war. He gave them good news and he gave them bad news. People are far more resilient than we think. And thus far, I've seen an approach on the part of Barbadians, the majority, that is willing to listen, that for the most part, they're willing to take instructions. And I have every confidence that whatever news we bring to the people of Barbados, we will fight this together. So I say all of that to tell you that it is absolutely nonsense for anyone to suggest that the government of Barbados has not shared the information and the true information on the results of the tests. I must tell you that every time the Minister of Health calls me now, I swallow, because I think he may be calling to tell me something. But thus far, there have been no tests. Now, the public health people believe it will come. The question is when. Why do some people get sick and others don't? Why do some people die early and others don't? There are things that are beyond your and my understanding.
No, if you could explain for Barbadians the various stages of our COVID-19 emergency response plan, you are Mr. Carter.
Richard, you want to take that, please?
Yes, so the government of Barbados has identified, through consultation with a range of public sectors and a range of private organizations, the full range of governance in Barbados, has determined that there are 4 stages that we are basically going to operationalize in the COVID-19 response. So there's stage 0, which is the stage we're currently at, where there are no cases. Move into stage 1 if there is a case, an imported case. Move into stage 2 if there is local transmission. In other words, if someone gets ill and without a travel history and therefore has been infected locally. Move into stage 3 if there is widespread local transmission. So it is a graduated set of stages from 0 to 3, each accompanied by the advice in relation to how the government and the whole of Barbados will be expected to respond in terms of the messaging, in terms of the information with respect to gathering, in respect of the information in relation to how we liaise and work with one another, in relation to the stages and the steps that will be taken by the government.
You mentioned bee gathering, Prime Minister. Yeah. Many people are asking, why don't you put a halt to bee gathering activities?
The truth is that we have made a determination that all gatherings larger than 100 would be restricted after we reach stage 1. We haven't reached there yet. But we do recognize that there's some large events that people are planning, particularly that may lead to outlay in advertising, outlay in buying supplies and food. And it may be wise, we're advising those persons to reschedule their events, any event within the next 3 months, to reschedule it until later in the year or next year. Why? Because even though we haven't had a case yet, you don't want people to spend money only to be told within less than 24 hours, and they will be told less than 24 hours that they need to cancel. So against that background, we've said, for example, for the week gathering, mass-based activity on Saturday and Sunday, don't have it, because we don't want vendors to go and buy food and then find out that they're out of pocket, because if you have a case on Thursday or Friday and the government has to cancel the event suddenly, you're not out of pocket. Against that background, I've told the Week Gathering Secretariat to start looking at more virtual engagements, because we connect even if we're not connecting physically. And I speak to my niece in Australia on a regular basis, and I can't touch her, I can't think, but I can speak to her. So we feel that the spirit of Week Gathering, particularly the Ideas Forum and other things, and maybe you can even find a way of virtual karaoke, but there are things that people can do, to, especially to hold a lot of the older people that we're asking to stay at home. You know, Patrick Gollop and others used to have radio programs that reflected the spirit of Barbados. If I don't know if you remember, Richard. One was Heartbreak Hotel. You might not remember that one. But the point is that we need to do things to keep the spirit of the population up, but we're going to have to pull back on the larger scale events for now.
You spoke about large-scale events over the next 2 to 3 months. However, crop-over events do start within a couple of weeks.
And those that are early will have to be held back. The music can go out. We can enjoy music without necessarily being out there. If it comes to that, we'll have to take those decisions going forward. You know, there was a time that there was a polio outbreak and they had to postpone Carnival to May, so that these things are not unknown to us. But at this stage in time, the government is looking at a 12-week horizon with respect to telling persons who are over the age of 70 or who themselves, I should have added, may have chronic conditions but that are not in good condition. And the way it was explained to me is that if you have your diabetes under control, you're pretty good. But a person whose diabetes is out of control is more likely to suffer. And why? This viral pneumonia, as it was explained to me, there's no cure on the face of it, and that's why people are working hard to see what combination of medications will work, antiretroviral, anti-malaria, etc. But what if your body is not strong enough to fight it off? That's where the danger comes. And therefore, persons who are particularly very old, or who themselves have chronic respiratory problems already, or who may be an bad diabetic with uncontrollable diabetes or bad cardiovascular problem, those are the ones. Now, there's a virtue to size at some point. Barbados is small enough that if there are persons who are in the public service, for example, working, who fall under that condition of an uncontrollable chronic NCD, come forward to your supervisor. Come forward to your head of department or your PS, and we will take care. And once your doctors say, look, you are somebody who really should be staying at home over the next 12 weeks, we'll deal with that. But there are those of us who are healthy. There are those of us who have to carry the weight. And you know, societies are held together by people taking and claiming courage and going on out front to be able to carry the rest of them. And regrettably, this is our turn.
Speaking about being out front, what is your response to anxiety amongst some immigration officials and other frontline workers who have to process visitors?
I don't want to single out immigration or anyone. I think that there's a general anxiety in the country. And our role is to be able to talk Barbadians through it. And that's why every day you're going to be hearing from the government, whether from a minister or Mr. Carter or the CMO or whoever, because we recognize that we have to keep reinforcing the message. Keep reinforcing the message. The worst thing that Barbadians can do, honestly, is to panic. We need Barbadians to listen to the instructions, particularly those coming from the Chief Medical Officer, particularly those coming from the Ministry of Health, those coming from Mr. Carter, and as the voice represents the actions of a whole government approach. And if we do this together, we've met with the labor unions, we've met with the private sector agencies, all of them, we've met with the church, we've met with the two main opposition parties. If we do this together, Lisa, we will get through it. And we'll get through it hopefully with minimal losses. We would like to say with zero, but we don't have control. None of us are God. We don't have divine powers. And the reality is that our country has gone through this and far worse conditions during World War I, World War II, during slavery. We've had all these examples of hardship that have tested our resolve. The panic is fueled largely by the American news cycle more than anything else. And the panic is also fueled by people not necessarily understanding what to do. We're trying to put out as much information as possible. I think Mr. Carter is now going to look at the kinds of statements that you should say to your children, to your parents, to your work colleagues. In other words, create 5 or 6 different scenarios that he will speak to. Richard?
Yes, because segmenting your communications is really important. We have different groups that have different vulnerabilities, have different levels of understanding, have different levels of exposure. And one of the things that we learned very early in the Ebola epidemic, and is applicable here, is that communication is absolutely important, ensuring that people know where to access information and can trust the information that they're being given, because trust is at the core and the center of all of this.
I want to add, I mean, you'd mentioned immigration officers and those on the front line. We went down 8 times to the port workers and talked them through this. Up to this morning, Richard, I think you were at the airport dealing with the airport workers, and you're going back again. So, and why? Because take, for example, the notion, most people feel the most natural thing is to put on a mask. Up to just now coming here, I was listening to the Director General of the WHO live in his press conference and his lead technical advisor. And up to just now, they said, do not use masks unless you're in a health facility, because the most natural thing is to fiddle with the straps of the mask. And it is in bringing your hands to your face, like the cameraman is doing, that will cause you the greatest trouble. It is in being able to make sure that you don't have that sense of comfort, because when you have that sense of comfort in your hands, with your gloves on your hands or a mask on your face, you're more likely to do things. When you have gloves on, you'll touch this, you'll touch that, you'll touch this, you'll touch that, and then you miss and touch your face. The biggest way to deal with it is not even the sanitizer, it's soap and water, 20, 30 seconds. Now, there are large groups of people who may feel nervous, and one of those is teachers. And we've said to them, look, we're going to talk. I want Barbadians to know that the only thing that we're going to give them is the truth. There are difficulties with the whole determination that you just shut down schools. The majority of children would then be home with grandparents or with older people. We're putting them at risk. Many of the children depend on school meals, both in the primary and some of the secondary schools. We're putting them at risk. Richard, I'm going to let you talk, because you shared some stories with me about Ebola and the closing of schools that have not left my consciousness. And the thing is that we don't know whether this is 3 months, 6 months, or 12 months to a vaccine. So that we need to be very disciplined. I've said to the Minister of Education when she meets with them tomorrow, if there are people who genuinely have a chronic NCD and are over 60, come and talk to us and we will make accommodation. And the rest of us who are in the system have to help lift weight. That's what we do. That's who we are as a people. That's who Barbadians are. So that these are difficult times, uncharted territory, but I assure you that our duty is to make sure that the schools are kept clean. Our duty is to make sure that those who are in the vulnerable population are insulated. Thus far, children and young people are not generally in that population, but the problem is that children may not want to wash their hands regularly. How many times you got to tell a child, I ain't tell you wash your hands? You're saying that over and over when they're running outside and they come back in. You wash your hands? So it's that kind of exchange that I need ordinary Barbadians to reflect on, and to understand that sometimes what is appropriate for another country may not necessarily be appropriate for our own country, and that what we are doing is following the science and the data. Richard?
Yes, so just very briefly on the education point, a decision will be made if it comes to that, if we reach stage 2, that a decision will be made in respect of institutions such as schools. But we have to weigh very carefully the consequences of the dislocation that will happen if we go to a premature closure of schools, because children are then exposed to a range of other things that we would ordinarily not want them exposed to. The Prime Minister mentioned a number of them, and we saw the outfall and the consequences of this in Sierra Leone, and we've seen it in other places where schools, they have the mass school closure, because the child care responsibility, the responsibility for instruction, the responsibility for the integrity of social relations, the strain that will be put on parents who are now concerned that their children are at home and therefore they themselves, in terms of their commitment to work, waivers. There's a whole raft of issues that follows out of a decision like that, and obviously we don't want to make a decision like that lightly.
Prime Minister, going back to your point about frequent hand washing. Now, frequent running water is still an issue for many rural parts of the island. What can you do to assure residents that they will have access to frequent running water?
I've asked the Water Authority to give my office a daily briefing as to those areas that may be without water. And we've also determined that we have, as a matter of urgency, the government, through protracted negotiations, have just come into 2 temporary desal plants. With the best will in the world, I'm told that that's still an 8 to 10 week exercise to get those operational. But we're trying to do that in order to bring water to those parts that may be without water. We've made it very clear that the tankers and more community tanks and individual tanks have to be deployed as a matter of urgency this week, where possible, and that we will continue to make sure that we can also buttress by providing. I've asked them to source the sanitizing liquids. I think they've been talking to Carlisle Laboratories and others to see whether we can source and bottle to make sure that those communities that may not have sufficient running water will have access to this. These are the things that Richard and others in the government are going to have to work with us to be able to get it into those communities as much as possible. Barbados is suffering from a drought. We heard Dr. Mwanza say that when they went into Bowmanston just here the other day, instead of finding 17 feet of water as they would expect at this time of the year, that he found water to his waist, and that was barely 3 feet of water. So that one of the consequences of the climate crisis, and it's a point that I'm going to make to the International Monetary Fund and the Development Bank soon, is that we in the Caribbean face not just the pandemic, but we face the ravages of climate crisis, both in terms of groundwater shortage and sargassum, but soon also with the hurricane season starting from June 1st. And that to that extent, the Caribbean region remains one of the most vulnerable regions in the world right now to what is a double potential calamity.
Let's look at the issue of supplies. Can you assure the country that we have adequate supplies of food and other, for instance, medicine, etc., after the frenzied buying last week?
Yeah, I mean, that was unfortunate. The Minister of Commerce, Dwight Sutherland, brought a paper to Cabinet Thursday night that clearly showed us what were the stock levels across a range of things. In addition to that, we then met with the President of the Chamber of Commerce, Mrs. Tanis, and one of her executives on Friday, and we are pretty much good with most of the items for 3 months. And what we've asked is that we keep a rolling stock of 3 months all the time, because we recognize that once we get deeper into the hurricane season, a combination of the hurricane season as well as the COVID-19 disruption of supply and logistics can put us in a difficult situation. At the regional level, last night, some of the heads of government and ministers of finance met, and we also agreed that we need to do a better job at regional food production, particularly at this time. In our own case, Barbados has taken a decision, and we shared this with the social partners and the church and the opposition last week, that we would seek to bring 750 acres back into production almost immediately into what we call short-term crops, 6-week and 12-week crops, 6-week livestock chickens, there's still fishing, so that we are reasonably comfortable that between our domestic production and our regional access, St. Vincent, Suriname, Guyana is having its own challenges now, but they can close their eyes normally and do these things. So that we are reasonably comfortable that we can make this process work. Okay?
How is the government responding to the charges
on the pharmaceuticals, we've said to the drug service that to not only treat to COVID-19 pharmaceuticals, but also treat to the general stock of pharmaceuticals, because we recognize that with panic comes panic buying, and we do not want our borders might, in some instances, be shut down from essential raw materials. So pharmaceutical production may be affected later in the year. It's what we call a lag effect. And therefore, we're trying to get as much as we can. The key is, with the Queen Elizabeth Hospital, with the drug service, that the average Barbadian who may have normal conditions to go to a hospital or to need medication should be able to continue their life on a day-to-day basis without us being affected by our plans to prepare for COVID-19. And that's why the isolation beds that we have are only 6 at Enmore, which is not on the QEH campus. The BDF Military Hospital, which is, we stood up yesterday, and they're starting to put it up fully at Paragon. And then Harrison's Point will also have another 56 beds. BDF is 40, Enmore is 6. So that, to give it context, Barbados, since we've had ICU, we've had only 30 critical care beds. New York has 3,000. Not 30, I said 30, I meant 20. New York has 3,000. With this ramping up, we will have 106 critical care beds, which is far in excess of anything, 5 times what the country has had for its entire history of the treatment of ICU facilities. New York, for all of the millions, Governor Cuomo said this morning they only have 3,000. So when Barbados ramps up to 100, you begin to see the extent to which we are providing scale. And we have put in additional orders for ventilators. We have some on island, but we've put in additional orders for them. What we're also doing is that last week we got 30 or 40 temperature guns, which is what they're using at the ports. But we've also said, look, we need to have the walk-through scanners that will also take people's temperature, and those orders have gone in for those. We hope that we can get at least one for the airport and one for the seaport. I've told them to try to see if we can get 2 for the airport instead of 1. But that will allow us to take additional precautionary measures. So has it been totally perfect? I've heard some instances where all flights weren't being manned. On the weekend, yesterday morning, I gave instructions to the Minister of Health that every single flight, without exception, is to be manned. And if you ask me why we've gotten through so well to date more than anything else, it's because of these precautionary measures. I mean, we didn't wait until this week or last week to get the temperature guns. We've been using them for 4 or 5 weeks. We didn't wait until now to see what we could do to boost hospital capacity. The work has been going on at Harrison's Point for 2 weeks, but before that, Parliament voted 5 weeks, 6 weeks ago to give $800,000 for the Elaine Canterbury Centre and the St. Lucie District Hospital. Those are almost finished and ready. We also voted last week money to get 2 portable dialysis machines for there, so that if people have to go there and need dialysis, they can still be quarantined and get dialysis without going to the QEH. And finally, we also agreed last week to be able to build out a surgical theatre at the Barbados Defence Force, because as Minister Walcott reminded us, a person may have COVID-19 but may need to have an appendectomy or may have broken a hand or need surgery of some type. We do not want to carry them in the Queen Elizabeth Hospital. We want to insulate the Queen Elizabeth Hospital. And when I heard Governor Cuomo both yesterday and today, I heard him make those same points, that the Army Engineer Corps is needed now more than ever to resurrect and to refurbish, rather, some old buildings. Because you can't, unlike the Chinese, build a hospital in 7 days. But we can refurbish some buildings just as we're doing at the old naval base in order to make sure that within a 3-4 week period, we have as many critical care beds. And I mean, it is a sight to behold. And when it is finished, people will realize that why are Barbadians taking this very measured approach? It's costing us $30 million to do this. This isn't 10 cents. But we feel that this is the best way to protect our people. That those who are on the front line of vulnerability in terms of age and chronic NCDs, that ease down. When we reach to stage 2, we might have to make it law. But at this stage, we're asking people just to stay off the road as much as possible if you're over 70. I've had to tell my parents that. I've even had to tell them that they probably won't see me for a while because I'm not going to put them at risk. And if I have to carry something for them, I'm going to carry it, put it on the front doorstep, and tell them, open the door after I leave, call them and say, it's there, and let them go for it. It's just not worth taking foolish chances. But equally, what I'm worried about is that boy and girl in the Pine, or in Penny Hole, or in Bush Hall, or in Parishland in Christchurch, who may be working in a hotel. She has 3 children. She doesn't know where the next food is going to come if she's laid off. She might get unemployment benefit for a few, 10, 12 weeks, whatever weeks it is. At the end of the day, what we also have to do then is to start construction going and other things going, domestic agriculture, so that we can make sure that they have access in the family. Because the child father may be able to work construction even if the mother can't work. And if we do those things, if we stop panicking, if we stop hoarding food going in, because I heard it clearly, when you go and buy and panic buy. All they're doing is stopping the next person from being able to get, and the next person only want enough for them. But when you panic buy for yourself alone, it runs counter to the Beijing share pot mentality that all of us grew up on. That's not who we are. And we must not let American television change who we are. We are people that look out for each other. We are people that even if you want to say that you don't want to be exposed, you're going to come and put the pot, as I said, right on the front door or the veranda. And you're going to say, Miss Ting, open up the door. I left it here now, but open up the door. You're going to see the pot there. I bring some food for you. That's who we are. So that part of the difficulty in managing this exercise is far worse because of social media and because of the American news cycle. And I'm asking Bajans, I'm pleading with Bajans, stay focused. Stay listening to official news. Help us help one another. Do not take foolish chances with yourself. Wash your hands every half hour or so, or anytime you touch a counter or any surface that you shouldn't touch. These are the things that will make a difference. If you don't need to go in large gatherings, if you're part of the vulnerable population, don't do it. And in any event, once we reach to stage 1, as I said, gatherings in excess of 100 will be restricted. So we have very clear stages. And the reason why the stages are so clear, the reason why the stages are being shared, is that people must see it just like how tonight comes after this afternoon, tomorrow morning comes after tonight, tomorrow afternoon comes after tomorrow morning. People must have certainty, and then people must have the assuring and calm voice of the Ministry of Health officials, of the other government officials who are dealing with them. We recognize, even if you close schools, for example, let's go back there, you have policemen and policewomen who have children. What are they going to do with the children? They're the ones who are on the front line helping us to keep order. We have soldiers who are at the airport who are helping taking the temperature. So that Barbados has to decide, are we in this together? Because if we are in this together, then we need to submit to leadership, discipline, and we need to keep order. But if we keep running here and pulling there and doing this and listening to this and listening to that, without staying focused and walking the path that we all know, the medical officials, the people who have gone through far worse conditions than this, they're telling us, if you can get Barbadian people to follow Kipling, if you can get Barbadian people to keep their head when all others around them are losing theirs, then we shall succeed. And I'm asking you, Lisa, and all who are in the media like you, and all who are in the medical profession, and all who are in the teaching profession, and all who are in the church, all who are leaders in this country, leaders in their community, help us bring along each other. Will we get nervous? Yes, of course we're going to get nervous because we're in uncharted territory. But are we going to stay focused? And if you want to change, or if circumstances have changed, come and let us talk. But what we can't do is run off in every possible direction, like a chicken without a head. The one you just heard there, but he got a head still. A chicken without a head. We can't do it because there's too much at risk. And the pandemic, I mean, I'm being reminded all the time, and Richard, you can quote the numbers, not me alone, when we've spoken to the Director General of PAHO, when we've spoken to all the CARFA, that the mortality rate for this is minuscule in comparison to some of the other more serious pandemics of the world. Minuscule may not be the right word, but relatively small in comparison. It is higher than the common flu at the moment, but that is because we are all of the opinion that the majority of people who have in fact had it internationally have not all been captured. So that when you start to look at how many people actually die from it, the numbers are much smaller. Now, having said that, one death is one too many. And that's why it is so frightening, because it's almost like lottery. We don't know who, and people therefore, if they can't control their environment, they can't control themselves, they get nervous. Wash your hands. Wash your hands. Don't touch your face. It's hard for me too, so I can imagine how it is for you. I've got to tell myself that if you're going to cough, that, or get a tissue, put it and throw it away in a garbage can straight away.
And wash your hands after it.
And wash your hands again after it. You understand? If you touch this counter, go and wash your hands. If you don't have soap and water immediately there, use the sanitizer. The solution is so simple that it's frightening. But equally, the consequences of not following it are equally frightening. And at the same time, the consequences of what I called 3 weeks ago the epidemic of panic are far worse than the epidemic of the virus.
Now, regarding adequate medical personnel, the long-promised nurses from Ghana, are they still coming?
They're supposed to come, but we've made it very clear that whether, and we've put in a request for nurses and medical personnel from elsewhere as well, whoever comes will have first, however, we believe, to go through a 14-day quarantine, because you're putting medical people then to work in a healthcare type facility. So we hope that we can still get them. Part of the difficulty that we're facing, as you know, is the regular supply of movement of flights in and out. So everything is fluid. The one commitment I give the Barbadian people is that you're going to hear me. You know, there was a song, I got tired of seeing my face. You might get tired of seeing my face, or Richard's face, or Santia's face, or Jeffrey's face, or Kerry's face. But we have to talk the country through it. And we give the country that solemn commitment, and that we will share whenever there is something to share immediately, not with a lag.
We're still going through a BERT program. How concerned are you of the economic fallout?
Concerned? I leave you to go up to do a video conference now with the rest of the Caribbean, with the IMF, pursuant to the meetings we had last night. My team has been working now in excess of 2 weeks. We think that we have the potential for a framework to go forward. It's subject to the final sign-off with the IMF and others, but we believe that we will get the fiscal space, because what we need now more than ever is a little fiscal space. Right now we are committed to a 6% primary surplus, as you know. To put it in normal Bajan language, I could lose weight at £6 a week, or I could lose weight at £4 a week, or £3 a week, or £2 a week. I'm still losing weight. So we may have to reduce the target by saying that our primary surplus should be no more, hopefully, than 3% or 4%. If we get it down to 4%, that gives us another $200 and something million. But it's not just in expenditure, because we expect to get reduced taxes. We expect to see reduced taxes from tourism, from VAT, in almost all of the transactional areas. And therefore, we're going to have a double whammy: reduced revenue, increased expenditure, and therefore we need the fiscal space. What is good? This morning, I looked at the foreign reserves. Our foreign reserves are $1,552 million. Now that, to give context, we inherited reserves at just about $440 million. That $1,552 million is the equivalent almost of 20 weeks of import cover. Last week, the Inter-American Development Bank agreed to a loan of 160 million Barbados dollars as a policy-based loan. When that comes in a few weeks' time, that will carry our reserves even to $1,710,000,000. And if we end up getting an additional financing package from the IMF beyond what they've given us, which is entirely possible, we will even go further. So our reserves are in good shape. In other words, we can do the spending there. We actually have cash. The problem is what we don't have is fiscal space. So it's a hard thing to have cash, but no fiscal space. And that's why we're going back to the IMF to be able to say, we can't lose weight at £6 a week no more. Let us lose it at £4 or £3. And that's the discussion that we're having now. We recognize that we're going to have to put some kind of job and business survival package in place. But we have to meet with people and see what their real losses are going to be, because the government doesn't have a lot of room. But equally, we accept that it is easier to get a business to ramp back up than to start one that has closed completely. And our aim is to be able to keep people's heads above water. You can't swim freestyle, you can't do breaststroke, you might have to dog paddle and tread, but just keep your head above water. And whatever it takes, it means adjusting what we spend money on, adjusting what we eat, adjusting a whole host of things. But we can get through this.
Speaking of the economic fallout...
We'll come back and give the country a fuller framework for the economic program. But at this stage today, I just want to ask Barbadians to don't panic, work with us, help me help you to help keep this country as safe as it can be. Let us look back at this moment in time as our finest hour. Let us look back at this moment in time as one in which all Barbadians put hands together and said, we can topple this. And we can do it because you are as strong as the weakest link among us.
I just have one more question regarding the economy. However, we are a tourist destination. I've been told that some flights are coming in half full. What kind of cushion would be given to the tourism sector, if any?
Well, we're going to talk to them. As I said, the Minister of Tourism is meeting with them this evening and tomorrow morning again. We've had some preliminary discussions last week with them. We are waiting on actual data from them. But we accept, as I said, that we have to help entities keep their heads above water. There's no doubt about that. But equally, we have to recognize that the rest of Barbadians, if you owe suppliers money and you can pay, pay promptly. Because there's a whole chain of people waiting on you and jobs that are dependent on you. And that's why we are being very measured in what we do, even with the borders. May I also say that we do accept that because Barbados does not command a big footprint in terms of air travel, that we can be the victim of others too. But what we've asked the airlines, and I know that the Minister, for example, has asked it of British Airways, of Virgin. Virgin is seeming to be in a little more issues because of its relationship with Flybe and other entities. But we're in the middle of discussions about the additional pre-screening measures which we feel should be put in place in addition to the ones that we have here on land when they come and hold the gun and take the temperature. Okay.
Mr. Carter, my final question to you would be, are you totally satisfied with Barbados's response, given your experience?
No, I'm not totally satisfied because that would be an acceptance of a position that is inconsistent with the reality. And just put simply, we really have to ensure that this is a whole of government approach, a whole of society approach, even beyond government. And we still have people that we have to get on board. We still have people who are engaging in inappropriate behaviors. They are not on board with us, and we have to get them on board. There's still elements of the government that we have to work with to ensure that we can be as prepared as we possibly can for what we ultimately expect will be a case or cases in Barbados. What I am satisfied with, however, is the resolution that I have seen from the government and the preparedness to ensure that they are disciplined, that we, because I have to speak in the first person plural now, that we take the necessary actions to ensure that we do the things that are required of us by the science, that are required of us by the international commitments that we have made. We have signed a lot of international commitments in relation to how we conduct ourselves, and therefore respecting the rights of everybody, but protecting also those rights. Those are at the fundamental core of things that we need to do as a society. And when we get there, I believe that we will be in the best possible position to respond to this. But the government of Barbados has been working on this, as the Prime Minister said, for a number of weeks. We have not come to the decisions that we have made by kind of looking into the sky and navel gazing. We've come to this on the basis of the best scientific evidence that is available to guide our decisions. And if we continue in that direction, then I think we will do the very best we can in responding to this.
Let me also say that, I mean, Richard talked about inappropriate behavior, and it reminded me, and I've been very clear, I said it last Tuesday, I say it again, this government is not going to tolerate price gouging by anybody. You cannot profit from people's suffering. You ever wonder why you never see a picture of me with any house fire victim? Because in 30 years, I refuse to profit from anybody's suffering. And I am not, as Prime Minister of this country, going to agree that anybody is going to profit from people's suffering. Secondly, I also want to remind us that, as Richard said, we need to get to as many people as possible, so that you who are listening, go and talk to your neighbor when this presentation finishes, this TV press interview finishes. Talk to your children, pick up the phone and say, are you doing the things? Reinforce each other's behavior. Why? Because not everybody in Barbados reads the newspaper. Not everybody in Barbados has a smartphone. And therefore we have to use multiple channels and multiple means, and we have to do it over and over to get as many people on board as possible. Because I'm satisfied that if majority of us do this, we are going to get through this with flying colors. But we have to do it together. And we start first and foremost, those over 70, those with chronic NCDs, after you talk to your doctor, get a little rest for 12 weeks. Okay? And if we can do that, then I believe you me, that the rest of us who can carry the weight will carry the weight for you until such time as the world has found a vaccine and to allow you to be able to resume your normal life across this wonderful country of ours.
Thank you, Prime Minister. Thank you, Mr. Carter. And thank you for joining us. That was Prime Minister, the Honorable Mia Amor Mottley, and our COVID-19 czar, Mr. Richard Carter, responding to your pressing questions that you would have had on social media. I'm Lorde from Ilaro Court. Good evening.